post-pandemic restrictions despite surging infections and criticism from medical experts. The mandate for wearing masks and social distancing rules have been scrapped. The British government on Monday said they expect hospitalizations and deaths to increase as infections continue to rise, but at a lower rate compared to January's peak, thanks to high vaccination rates. Officials also urged people in their 20s and 30s to get vaccinated. All right, for more on this, I'm joined now by Dr. John Campbell. He is a UK-based health analyst and educator. Dr. Campbell, it's good to see you again. According to the polls, more than half of the Brits say they are worried about removing restrictions. Is it a good idea for the government to lift the restrictions now?
That's a remarkably good question. The government and the main scientific advisors of the government are saying that this is the best time. They're saying that if this is delayed further, it's just going to delay hospitalizations. And it's best to do this now when we've got the summer on our side, when we've got the vitamin D from the sunshine, when we've got the ultraviolet, when we've got the ventilation outdoors. It's best to do it now rather than delay it into winter time. But as well as that, we've had a letter to the Lancet recently with about 1,200 scientists writing in and doctors saying they're very concerned about it. And there's a real debate going on in the UK about this now. We've got a lot of people on one side, a lot of people on the other side. And basically, this is a UK experiment. I think we can only call it that. So the world needs to sort of watch this with interest and see what the outcome is going to be, because there's a lot of unknowns. Let
me ask you about the Prime Minister, Boris Johnson. He has gone into isolation, having possibly been exposed to the virus, just as the country lifts restrictions. What signal do you think does that send?
Well, infections are going up dramatically. So there's been about 47,000 infections on average per day over the past week. And the doubling time is probably about every 11 days at the moment. So the infection rates are going to go and increasing. It's going to be 100,000 a day pretty soon. That is pretty well inevitable. And of course, the Prime Minister had hoped to have a grand triumphant opening, but that was before the Delta variant really took hold and caused this dramatic increase in cases. So the Prime Minister, and indeed two of the senior cabinet ministers, the Minister for Health and the Chancellor of the Exchequer, are actually all in self-isolation at the moment for a period of 10 days, as are many, many other, well over 500,000 people in the country. We call this being pinged because the app actually informs you. It pings, and the NHS app informs you have to self-isolate for 10 days. And this is actually a real problem just now. It's a problem for the NHS. It's a problem for supermarket workers. It's a problem for transport. And this has to carry on for the time being. The Prime Minister's made it clear today it has to carry on for the time being.
You say that the world will be watching England. This is a case test, if you will. But what will they be looking for exactly? And I'm thinking about the fact that we're hearing that most hospitalizations with COVID-19 are in people who have not been vaccinated. Is this going to show us how far we can go in a society where you have people who still remain unvaccinated?
Yes, they're going to be looking at a lot of things. They're going to be looking at the number of cases. They're going to be looking at the number of people getting sick, the number of people hospitalized, and of course, the number of people dying. Now, we are getting a lot of people hospitalized who have actually had 2 doses of the vaccine. But this isn't really surprising, because the higher risks of the older people are the ones that have been vaccinated already, and those with comorbidities. And we already know that they're most likely to be hospitalized, bearing in mind there's still about a 10% chance of being hospitalized, even if you have been vaccinated, because the vaccines are about 90% efficient in terms of protecting against hospitalization. But they're more protective against people dying. So the world is going to be watching these parameters. The main variable, the reason there's so much uncertainty about this, is we don't know how people are going to behave. So if people are going to carry on basically behaving as they were last month, then the rise in cases will be more moderate, and more importantly, the risk of hospitalizations, which are going to go to about 1,000 a day, can get below 2,000 a day. If hospitalizations get to 2,000 a day, that's putting a strain on the health service. And if they go beyond that, then probably restrictive measures are going to be needed. And of course, we also need to look out for new variants and vaccine immune escape. So there's quite a few things to watch out for over the next few weeks. It's going to be interesting, but actually living in the UK, it's a little bit frightening as well.
Yeah, and it just makes you wonder, a good dose of common sense probably would help in the equation as well. Dr. Campbell, as always,
absolutely.
Good talking with you. Thank you.
Thank you, Brent.